Hi all, this is Dr. Vince, physical therapist at FTR in Joliet. I was recently asked the question, how can physical therapy help patients who are diagnosed with fibromyalgia syndrome? And there's a lot that goes into that answer. So I'm going to break it down into 4 major topics that we know in which PT can help. The first one is education. There's something out there now called pain neuroscience education. It's a fancy term for essentially saying education and guiding that patient through the pain process. And what we know is that pain is an output from the brain. It's not necessarily an indication that something is damaged, which is what has been traditionally thought of as why people have pain. And when we start to break it down into that term, in that, pain is more of an output from the brain, we can start to see that anything that would affect your brain or nervous system could actually affect your pain. And with that, I think everybody now agrees that fibromyalgia syndrome has one thing at its core, and that is central sensitization, which means that your nerves are highly irritable. And you can find that throughout many research studies regarding fibromyalgia syndrome. And when your nerves are highly irritable, it means that it would take a lower stimulus in order to cause the same amount of pain that a higher stimulus would cause. To put that into layman's terms, for some patients, this wouldn't hurt. But when you have that lower threshold, just touching the skin is highly sensitive. Or anything that could produce a painful response, such as heat, chemicals, pressure, anything that could theoretically cause pain would cause pain with a lesser intensity for somebody who has fibromyalgia syndrome. And with that being said, for the brain, we can also affect pain from this top-down type mechanism, which means that if you're highly stressed, if you're catastrophizing means that you start worrying to a higher extent with the problems that you're experiencing or with the pain that you're experiencing. Fear avoidance, that you stop participating in the activities that you were previously participating in or the activities that you previously found enjoyable. What we want to try to do as PTs is to try to stop this cycle of worsening and minimize the amount of catastrophizing that the patient would do. And we can do that through education. And we know that if we provide the right education to the patient, we can actually start to reduce their symptoms over the course of time. The second thing that I want to address is passive treatment. And passive treatment has been the staple of physical therapy for decades, if not centuries. And passive treatment is where the patient comes in and things are done to them instead of the patient doing things for themselves. For instance, ultrasound, TENS, soft tissue massage, what else would be considered a passive, just being in water, balneotherapy, those are considered passive treatments. And we want to try to minimize passive treatments for 2 reasons. One is it starts to create a dependency on the therapist, that the patient needs the therapist in order to get better. And that's the last thing that we want to do. We want to try to empower the patients to be able to be independent and progress their activity level on their own, with us being more as a guidance or using us more as a coach to figure out whether or not we're progressing in the right fashion or if we're overdoing things. And the other thing is it starts to create maladaptive beliefs. For instance, if the patient believes that they have a problem because we're telling them that we're going to use ultrasound to try to increase blood flow, then they may believe that they have decreased blood flow in that area. If we use TENS to tell them that, or some sort of electrical stimulation to tell them that we're going to decrease pain, they may believe that there's actually something going on in there that's causing them to have more pain, and the TENS or some sort of electrical stimulation is magically fixing that. And the last thing that we want to do is put those false beliefs into the patient's head. We have to make sure that we're basing our treatment in science, and the science that we know up to this point at least. Okay, the third thing that we know therapy helps with is the addition of exercise. The strongest evidence for the treatment of fibromyalgia syndrome is the use of exercise, and that's both aerobic exercise, such as walking or the bicycle or arm bike, swimming, and strengthening exercises. Exercises in which you're purposefully trying to become stronger at. So that's the biggest thing that you can get from therapy are those three things. The fourth one is more of a wild card. Okay, this one is therapeutic alliance, meaning the better relationship that you have with your therapist, research actually shows that your outcomes are better. So if you have a therapist that's listening to you and is taking your concerns into consideration and is actively working with you as a team in order to try to improve your symptoms, those patients tend to do better than patients that show up to therapy that are in a crowded place. The therapist may not be paying attention to the patient. There may be more than one patient in there at a time. The patient just won't feel cared for. And that's the wild card, because that has more to do with the environment that you're in, more so than the actual therapy or treatment that you receive. But what we do know is that patients that have a strong therapeutic alliance or teamwork with their therapist actually do better and get more out of therapy. So I hope this helps. I'll come out with a blog post at some point to discuss some of the research behind fibromyalgia syndrome. But if you have any more questions, feel free to comment on the video. And yeah, if you have any more questions in general, or you want to see more videos produced that are educational in nature, please reach out. Have a good day.